Hello and welcome to Anticlock Academy. I am Dr. Christian Mohan Kapoor, and today we are going to dive into the fascinating world of muscle anatomy of the face. In this video, I'll provide a general overview focusing on two major categories of facial muscles: the muscles of expression and the muscles of mastication. We'll also touch on their nerve supply, how they function, and their depth in tissue layers. Let's get started with muscles of expression. The muscles of expression are responsible for the facial movements that allow us to convey emotions. Everything from smiling to frowning to raising our eyebrows. These muscles are typically small and superficial, lying just beneath the skin. Some key muscles in this group include frontalis, which is located on the forehead. It helps raise the eyebrows and wrinkle the forehead. Orbicularis oculi, which surrounds the eyes and is responsible for closing the eyelids, squinting, and blinking. Zygomaticus major and minor. These muscles, they pull corner of the mouth upwards, allowing us to smile. Then we have platysma, which is a thin muscle in the neck that helps pull the skin downwards. Orbicularis oris, which is a muscle which surrounds the lips and is responsible for movements like puckering and closing the lips. These expression muscles are primarily superficial, meaning they are located right beneath the skin, allowing for quick and visible facial movements. Next, we move to muscles of mastication. These muscles are responsible for the movements that help us chew. Unlike the muscles of expressions, these muscles are deeper. Key muscles in this group include masseter, one of the strongest muscles of the face. It helps elevate the jaw and close the mouth. Temporalis, it is located on the side of the head, and this muscle helps elevate and retract the mandible. Then we have medial and lateral pterygoids. Medial pterygoids works with the masseter to elevate the jaw and also helps in side-to-side movement of the jaw, whereas lateral pterygoid is responsible for protruding the jaw and assisting with the side-to-side movements. These muscles are located deeper in the tissue layers and are essential for effective chewing, grinding, and controlling jaw movement. Now let's briefly talk about the nerve supply to these muscles, as understanding this is crucial for both aesthetics and clinical applications like botulinum toxin. The muscles of expression are primarily innervated by facial nerve, which is the seventh cranial nerve. This nerve controls all the facial muscles that allow us to express emotions. On the other hand, the muscles of mastication are innervated by the mandibular branch of the trigeminal nerve, which is the fifth cranial nerve, which is responsible for transmitting motor signals that control chewing movement. The role of these nerves is vital not just for facial expression and eating, but also for aesthetic procedure like botulinum toxin, as this procedure temporarily relaxes specific muscles by blocking the nerve signals. Finally, let's talk about the depth. The facial muscles vary greatly in depth depending on the type and function of the muscles. Superficial muscles, such as those responsible for facial expression, are located right under the skin. These are the muscles that are typically targeted in non-surgical treatments like botulinum toxin because they directly affect the appearance of the face on the surface. Deeper muscles, like those of mastication, are located much further beneath the skin, are important for activities like chewing and jaw movement. These are also affected by treatment like botulinum toxin when used for jaw slimming or for reducing the size of the masseter muscle. Understanding where these muscles lie in relation to other structures such as nerves, fat pads, and bones is crucial for performing safe and effective aesthetic treatments. In conclusion, understanding the muscle anatomy of the face is foundational for both clinical procedures and aesthetic treatments. The muscles of expression allow us to communicate emotions, while muscles of mastication are essential for chewing and jaw movement. Each of these muscle groups has its own nerve supply and depth in the tissue layers, which impacts how they function and how we treat them in aesthetic procedures. In subsequent videos, we will go into more details on how to approach these muscles, specifically when injecting botulinum toxin, especially when it comes to targeting muscles for wrinkle reduction or for facial contouring. Thanks for joining me today. I hope this overview of facial muscle anatomy has been helpful to you. Don't forget to like, comment, and subscribe for more detailed discussions and insights into facial anatomy and injectables. See you in the next video.